Okay, we'll talk about preschooler growth and development. As far as growth goes, blood pressure will continue to slightly increase. Normal's around 100/60. Weight and height increase is very minimal. Weight is about 4.5 pounds per year. Height is about 2 to 3.5 inches per year during the preschool years. Heart rate decreases to about 85 beats per minute, being considered normal. Developmental milestones. Preschool's 3 to 5. So at 3 years of age, Erickson's theory is an initiative versus guilt. The child feels good if they can do things themselves, such as dress themselves and feed themselves. Otherwise, they feel guilty. Starting at 3 years of age, so once someone is over the age of 3, you pull the pinna of the ear up and back for medications or assessment. Prior to 3 years of age, you pull it down and back. We're still at 3. The preschoolers should be able to undress themselves, stack blocks, run, alternate their feet on the stairs, and they are very imaginative starting at 3 years of age. They have a great big imagination. They begin associative play, so they start to play with others. And this is a time of magical thinking, so they like to play pretend. Back to being very imaginative, so imaginary friends are very common and normal during this time frame. 4 years of age, they should be able to start to do simple buttons, so maybe start to dress themselves. They're in constant motion, they like to jump, skip, and they love pretend play. Again, that magical thinking, playing with others, and they love to pretend. 5 years of age, they should be able to draw a 6-part figure, lace their shoes, throw a ball overhand. They like games with numbers or letters. Again, we've mentioned imaginary friends. Denver developmental screening is a screening technique to make sure the child is hitting all their developmental milestones. We as nurses would not implement that or do that screening because we are not trained to do so. Time orientation begins in the preschool years. We talked about Erickson being initiative versus guilt. Piaget is also mentioned in ATI, and it is pre-operational thought during the preschool years. The preschooler's total egocentric, thought to be social awareness and understanding others' viewpoints. And this is where magical thinking, animism, and centration, which is the focus on one aspect of considering the whole thing, that's part of Piaget. Safety, we want to teach safety around strangers, bullying. Preschoolers should be taught how to call 911 if needed. Automobile safety, so maybe they're in a forward-facing car seat or a booster seat. And then bicycle safety, so make sure they're wearing their helmets and the safety pads that they need while they're riding their bicycle. Preschoolers, it's good to offer a variety of foods, snacks, fruit, cheese, milk, other than sugary snacks, and making sure they're getting daily exercise is very, very important because of the high obesity rate. Kids generally have 20 of their baby teeth by 3 years of age. Make sure that the parent or caregiver is supervising their brushing and their flossing. Trauma to the teeth is common during the preschool years because they are such in motion, jumping, skipping, playing. So trauma is very important. We will touch on immunizations when we talk about the lecture that we talk about immunizations. All children who outgrow their car seat should move to a belt positioning booster seat until they are 4 feet 9 inches and between 8 to 12 years of age.